Good morning, students. Nice to see you today. Today we're going to be talking about diltiazem, which is the prototype non-dihydropyridine calcium channel blocker. It is indicated for hypertension and angina. It increases exercise capacity, reduces heart rate and blood pressure, may increase cardiac output, improves myocardial perfusion, and is used to manage stable and unstable angina. Jennifer is going to talk to you a little bit more about the mechanism of action of diltiazem.
Alright guys, so calcium channel blockers as a whole end up inhibiting calcium from entering cardiac smooth muscle cells through the slow channels on the cell membrane. Diltiazem in particular also speeds the exit of calcium from the cell by stimulating ATP-dependent calcium pumps and sodium-potassium pumps. So some general effects of calcium channel blockers is that they produce relaxation of coronary vascular smooth muscle and they cause coronary vasodilation. They also work to increase myocardial oxygen delivery in patients that have vasospastic angina. Calcium channel blockers have a negative inotropic and chronotropic effect, meaning that they reduce contractility and heart rate. Hey Dana, what can you tell me about the pharmacokinetics of diltiazem?
Yes, Dr. Zucker, I can tell you about the kinetics of the drug. There are two ways to take it, orally and IV. The onset of action is with the immediate release tablet is 30 to 60 minutes. The absorption is 98% with the immediate release and 93 to 95% with the extended release capsule. The distribution of the drug is 3 to 13 liters per kilogram and 70 to 80% is protein bound with the drug.
You're on the right track. How about metabolism? Can you tell me about that?
Yeah, metabolism. The metabolism of the drug is by CYP450 enzymes. It does undergo extensive first-pass metabolism to mostly inactive metabolites. The half-life of the drug ranges anywhere from 3 to 9 hours, whether it's extended release or immediate release. The excretion of the drug is through the urine. 2 to 4% is unchanged, and then the remainder is also through the feces. Patients that have renal impairment or hepatic impairment do need dose adjustment.
Now that Dana has talked to you about the pharmacokinetics of diltiazem, I'm going to tell you a little bit more about the adverse effects. Greater than 10% of patients end up having cardiovascular effects such as edema or central nervous effects such as headache. Other adverse effects include bradycardia, hypotension, vasodilation, flushing, palpitations, and dizziness. The main concern when taking diltiazem is that it can cause conduction abnormalities, first, second, or third degree AV blockage, or sinus bradycardia. If you're a patient who already has impaired ventricular function, then there's a higher incidence of these adverse effects. Now Nishan is going to talk to a patient and give them a couple points of counseling.
Hi Megan,
Hello.
here is your diltiazem.
Thank you.
And what did your doctor tell you the medication was for?
He said it was for my high blood pressure.
Okay. Before you take this medication, make sure to let your doctor know if you have low blood pressure, a recent heart attack, or are breastfeeding. And also, make sure to tell your physician all of your health problems. And list all of the vitamins, prescriptions, over-the-counter medications, and natural products that you are taking. And for best results, when taking it by mouth, swallow it whole. Do not crush, break, or chew the tablet. And don't miss doses. And please be careful when you take this medication because it may cause dizziness, lightheadedness, or fainting. And to help reduce the risks of dizziness, make sure to take your dose while you're sitting in bed. And then slowly get out of bed and slowly stand up to make sure that you're okay. And also, don't drink grapefruit juice while taking this medication because it may increase adverse effects. And to store the medication, store it at room temperature in a dry place away from light. So do not store it in your bathroom. And what questions do you have for me?
I don't think I have any questions. Thank you.
All right, you're welcome.
Some important other considerations for using diltiazem is that in the elderly, they may have increased hypotension and CNS effects and constipation as compared to using other classes of antihypertensives. Pregnant and lactating women should not take diltiazem. Thank you for listening to us talk to you today about diltiazem. What questions do you have for us?